Hello, this is Kelsey, and today we'll be comparing and contrasting the effectiveness of EMDR therapy and somatic experiencing therapy in patients with PTSD. The DSM-5 criteria for PTSD, you need at least one stressor, and you could have witnessed this or experienced the trauma yourself. You could have direct exposure, you could have indirect exposure, you could witness the trauma, or you could learn that the trauma happened to a close relative or friend. That can still be a stressor. And one stressor could also be indirect exposure to details of the trauma. And that is usually a stressor in people who have professional duties relating to trauma, like first responders. And you need at least one intrusion symptom, and that is when the traumatic event is persistently re-experienced. And that could be in many ways, that could be brought up in many ways, like unwanted or upsetting memories. It could be nightmares, flashbacks. It could be experiencing emotional distress after being reminded of the traumatic experience. And you could also have physical reactivity to reminders of that traumatic experience. And you also need at least one avoidance symptom. That's you wanting to avoid the trauma-related stimuli, something that reminds you of the trauma. And that is anything that can trigger trauma-related thoughts or feelings in any way. Negative alterations in cognitions and mood. You need at least two negative alterations. One of them could be negative thoughts or feelings, and that could be worsened over the trauma, or exaggerated blame of self or others for causing the trauma. Decreased interest in anything, in your loved ones, in activities. And you could also feel isolated and difficulty experiencing positive emotions. Symptoms must last for at least a month, and the symptoms must cause a significant amount of distress in your life. And the last criterion is that the symptoms cannot be due to medication, substance use, or any other illnesses. A brief introduction of these two studies is that both groups in these studies are patients with PTSD, and both studies are conducted to find how effective their treatment is. One treatment being somatic experience, and the other being EMDR, or eye movement desensitization reprocessing. EMDR it's a very common and widely used treatment for PTSD, and was first developed by Dr. Francine Shapiro in 1987. And what EMDR does, it's a therapy method using bilateral stimulation, such as eye movements. That's the most common. And it falls under the psychotherapy modality. And what the eye movements and bilateral stimulation does is it enables the brain to reprocess distressing experiences, and it also reduces the patient's emotional intensity. Somatic therapy, it was first developed by Dr. Peter Levine in the 1970s, and what that does is it helps individuals process and realize their stored stress, and it focuses on the connection between the individual's mind and body using techniques like breathwork, grounding exercises, and mindful movements. And that falls under the body-centered psychotherapy. My research questions for these two upcoming studies is which therapy is more effective, and hopefully both of them are effective, but which one do we think is more effective? Source 1, the EMDR for PTSD, it is a 268 participant study, and they were randomly assigned. It was originally 278, but 10 dropped out of the study. And on average, the patients received 7.3 EMDR sessions, the minimum being 1 and the maximum being 30. And they used 5 different scales to measure these results. The impact of event scale revised is for PTSD. The generalized anxiety disorder scale is obviously for anxiety. The patient health questionnaire 9 is a self-guided questionnaire for depression. And the validity of cognition, the subjective units of distress, assesses the changes in emotion. And over here is the traumatic events that the participants experienced. So if it is successful, hopefully they're successful in all ranges, so it could be proven to be more effective. Now, the results of this, as we can see, are pretty significant here. This was before the EMDR, this was right after, and this is a follow-up. And it seems like each test after the treatment showed significant positive changes, and the symptoms are notably relieved, and the cognition, as we can see here, went up, which I believe that is a positive thing. Source 2, somatic experiencing for PTSD. There were 63 total patients that were accepted for the study. 33 experienced the somatic experiencing, and 30 there were 30 control patients, and they were waitlisted. They will be receiving the somatic experiencing after their study. 2 of the many techniques used were titration, and that is managing arousal levels during the processing of traumatic triggers. And the second one was pendulation, which is balancing between regulated and dysregulated parts of the body. The 3 scales used for this study are the clinician-administered PTSD scale, and that is a structured interview for the PTSD assessment. And the post-traumatic diagnostic scale is a self-report measure for PTSD symptoms. And the Center for Epidemiologic Studies depression scale is a self-report scale for measuring depression symptoms. As we can see here from this table, is that the demographics are very vast, and it seems like a very good range of participants. And the results of the somatic experiencing, they also seem to be very significant. Here's was before, and here's after, and here's a follow-up. And the second assessment found significant reductions in symptoms, as we can see here, here, and here. Now for my reflection, both studies support their hypothesis of their treatments to be effective. Both of these numbers look pretty effective. However, source 1, the EMDR, seems to have more significant changes than the somatic experiencing. However, we do need to keep in mind that they use different tests and different ways of testing the PTSD symptoms. So we just need to keep in mind when looking at these numbers. It also seems like somatic experiencing might be less effective though. However, they have explained that external factors might be a reason, and they explained that while the study was conducted, it was a period of ongoing collective trauma in their community. And because they're based in Israel and there's a lot of political unrest going on during the time, But they also stated that 44% of their participants lost the diagnosis of PTSD. So that seems pretty significant either way and pretty effective. So I do believe that both of them are very effective ways, very effective treatments for PTSD. And here are my references. We got the DSM-5, the somatic experiencing study, and the EMDR study. Bye.